Jose, thank you so much for coming on to the podcast. I really appreciate it. Can you tell the audience a little about yourself and introduce yourself, please?
Sure. My name is Jose Mendoza, and I'm a doctor of Chinese energetic medicine. That's an alternative medicine that, although on the surface shares theories that coincide with acupuncture, I do the same things and you get the same benefits without the needles. And it is an energy medicine, but it's not like Reiki. So the difference would be if you were to have a general practitioner that prescribes you medication versus a surgeon that would be able to actually go to the root issue and remove it. And so that's something that I've been doing for the last 4 or 5 years now. I just recently finished the doctorate, and
Well,
now I'm here on this
congratulations.
wonderful.
Thank you so much for coming on this podcast. And can you tell us a little bit about your story? Like, how did you get to like this point? Like, what were your beginnings like? Why did you even bother studying Chinese energy medicine?
When I was 5, I had lots of memories at that point already of my mother being in the hospital. So a lot of it was work-related injuries, but for whatever reason, mom was always in the hospital. That's what I remember. And from a very young age, because I saw how the hospital would help her, I naturally wanted to go and be a doctor of sorts, a physician. So as I got older, over time, I kept my focus on that and I began to go through the process. Medical school honestly was a bit out of reach for me at the time, but instead I found something different that was also related to issues that my mom had. My mom has had cardiac issues in the past and she still has some, but it took me to a turn where I began to work in cardiac surgical procedures. So I wasn't the doctor. I'm standing side by side with the doctor, handing him the tools, helping out the procedures, being an extra set of eyes and hands to do the actual procedures at hand. And they're all minimally invasive. We do all sorts of things. But at the same time that I was going to school for that, I saw this poster, this little flyer, and it was for an event. And it sounded interesting. It was breath work, it was Qigong, which I had kind of heard of at the time, but wasn't sure what it was, and several other things. I attended the event, and I was pretty blown away. It was a good event, and it introduced me into the Chinese energetic practices. For example, Qigong. Qigong, as an aside, stands for energy and work. So it's learning how to work with the energy of life. And that was my introduction. So over the years, although I was working in the medical field through the cardiac procedures, Qigong, this energy work, was kind of lingering in the background as I worked with it. And so it started to come to a head when in 2020 we had COVID happen. So lots of things were shut down. And inevitably, I was put in a position where I could now go for a doctorate. So the man that offered the doctorate, Dr. Jerry Allen Johnson, he had been retired at this point for, I think it was 12 years. So he had been retired and he came out of retirement specifically to teach this. And so now I had this opportunity to be able to attend the doctorate and go about doing this because although the work we do helps people in the cardiac procedures, we did tend to see the same people coming back for the same issues, usually because it either is persistent for whatever reason or because certain lifestyle habits they wouldn't give up. We had people that were constant smokers that would come back. And so the thought was always, we're not really helping them solve the issue so much as just to make them feel better. Why are they caught in a loop? And so through the doctorate training, through the understanding of how not just energy works, but how people function, then I started to see why patterns like that arise and what people can do to help break those patterns. And so this is a much more fulfilling aspect to me because now when I go through, I can actually see lasting change in people.
Wow, it's really impressive. So you studied under like these renowned teachers like Dr. Jerry Allen Johnson, like you mentioned, and Pedram Shohai. I'm not sure if I'm pronouncing it right. I saw that on your website. I mean, how did
Right.
their teaching influence your own approach to like energy healing?
Well, it's one of those things that when it comes to energetics and you read about it and you look at it, you think to yourself, okay, reading it is one thing, but reading it, in this case, reading it teaches you nothing. You just kind of grasp the concepts. It's the experience in and of itself that really leads to a more profound understanding and a relationship with the work itself. So when I first attended the first event, it was all experience and you get a great experience out of it. But the problem is the upkeep. And so as I met these other instructors that I was going to, and learning from, what ends up happening a little bit is you end up becoming a collector. And there is some of that happened for me where it's just like, let me gather, let me gather, let me gather. But it's through the experience, it's through the use. So it's not until you actually experience something that you gain a deeper knowledge, wisdom, and understanding and respect for it. And so that's what kind of led me that way, was once you really get that experience, there's the gold. That's what gave me the understanding that the saying goes like this: doctor cuts, but cut heals. The body itself will heal the cut. And so, with that understanding, you could do the same yourself. What's in the way?
Wow, that's really powerful. And like you kind of emphasize working on like physical, energetic, and maybe even spiritual levels all at the same time. Can you explain why that's like important to get, long-term results?
Absolutely. So, have you ever heard of the phantom? I think it's the phantom itch sensation or the phantom sensations.
No, I
If
haven't
you
heard about
Okay. So when someone receives an amputation, whether they lose a leg, they lose an arm or something, occasionally what happens is they develop an itch. If I'm missing my hand and I'm itching on the hand, what do you do about it? It's a very strange phenomenon that in the West, we have no idea what causes it or why it's there or how to resolve it. But when you look at the theories of Chinese medicine, especially the practice that I went through, there's three aspects to the human body. There's the physical, which is quite easy to see, yes. Then there's the energetic. It's a little harder to understand, but think of like an emotion. An emotion would be an energetic representation of the body. And then there's the spiritual, which would be like your thoughts, your consciousness, and so on. Now, each of these have a casing, so to speak, that contains these. So they communicate between each other. What the spirit body will tell the energy body will relay to the physical body, and vice versa. So let's give you an example to really solidify this. If I want to make a sandwich, first I think about it. That would be the same as the spirit body communicating. Hey, sandwich. Great. Then the energy body steps in, and the energy body will animate me. Okay. The physical body will be animated by the energy body to go create the sandwich that I thought. Now, if you have a missing limb, the spiritual aspect of the person doesn't know the difference. It'll communicate down to the energy body, hey, this needs to be done. Now you have a little bit of a conflict because the energy body will say, there's nothing there. I can't work on this. And so that's one example of like a blockage because there's nothing to relay and there's nothing to receive it. So they're all intimately connected. You can't really separate them, so to speak. What happens on the physical plane will affect the spiritual plane. And to put this in a different way, we're sitting here, let's say a lion comes in the room, wherever you are. Immediately, you're going to have a reaction. You'll have a physical reaction. Your blood will begin to go towards the muscles because you need to survive and run. Your heart rate begins to elevate. But at the same time, what happens is the emotion comes into play of fear and you begin to react. So it works on all three levels, regardless of the situation.
So do you have like a set, I guess, like approach to like working with each of your clients? Is it like kind of like the same thing? How can you maybe explain to like the audience how does it work? It's like you said, like Reiki, they put like their hands on people usually, unless they're doing long distance Reiki. But usually they put like their hands either close to the body or on the body. Is that similar to how you do your energy work, or is it different?
It's similar, but it's different. Just like a surgeon has more tools than a general practitioner does, so do we. Although Reiki uses like emission and we'll use emission, there's other various tools that we'll use at different times depending on the situation. So our system is evidence-based. If you think about China and you think about the history that China has had, so after the communists took over China, now we want to elevate the state. Everything is done for the state. Everything belongs to the state. You couldn't have sick people. You need those people to work for the benefit of Mother China. So what then happened was in the clinics, they would begin to test things. So first, the communists got rid of all of the folk medicine that existed in China. Then they decided to bring it back. And that's what we know as traditional Chinese medicine now, TCM. So they began to bring it back and they began to try to scientifically validate it through a Western medical perspective. And the benefit we got from that was if it worked and got those people better so that they could work for the benefit of Mother China, we kept it. If, for whatever reason, it did not work, toss it out the window. So our system that we use, one that I use, is derived from that scientific understanding. It either works or it doesn't. And we don't use it if it doesn't work. So to answer your question, when someone comes in, we do have a set protocol that we always start with. However, because this is Chinese energetic medicine, there's also shamanic roots to it. In other words, part of it is also intuitive. For example, the other day I was mid session and I understood that there was something else that I needed to do. Now, I had already relayed to the patient that there's a specific protocol that's done. This is what I'm going to do. And they know. But mid session, this needed to be done. And so, as I was doing that at the end, I said, hey, this is what happens because everybody's different ultimately. We could use the same things. It works for most everybody because at our core, we're the same. But the stories are different. Just like you and I, we're both people, we're both men. Our backgrounds are different, our understandings are different. Thus, our filters of the world are also different. So we have to honor that too. And whatever pops up and is ready to leave is what is ready to leave.
Interesting. So, did you receive all your training here in USA, or did you actually go to China to receive some of this training?
Most of it was done here in the USA. I did go to China and do some training recently out there. So I was there for about 2 weeks working with the Nanjing Traditional University of Chinese Medicine. And in conjunction with them, we went ahead, we had clinical time, we had observation, we had a course, like mini courses, what's the term for it? Basically talks. People came and gave talks. And then, of course, application as well.
Interesting. So, do you do this energy work at Western traditional medical clinics, or do you just have your own clinic?
Although we could work in a Western medical clinic, typically my clinic is set aside. And so I work separately from that. Right now, I'm currently with an acupuncture in their clinic working alongside them.
I mean, and so do you work with Western medical doctors, or how do they perceive this Chinese energy medicine? I mean, do you see it as a different system? Is it complementary, or is it really two separate things? Do you ever get referrals from medical doctors, or?
I do have some medical doctors, some DOs that I get referrals from. It really depends on the person because, as you know, there's different faiths in the world. Yes, you can talk about Christianity, you can talk about Islam, and so on. Within the medical community, sometimes just like with religion, there are blind adherents to whatever it is that they believe in. So of course, for some of them, they don't believe in it. They don't believe in acupuncture. They don't believe in any of it that it works. They just believe in their tested system, and that's fine. But for others, they're a little more open because they can actually see that there's shifts and changes. Now, can it be a complementary medicine? Yes. Can it be an integrative medicine? Yes. Can it be its own standalone? Yes. That's why it's an alternative medicine as well. The good thing about Western medicine, especially for people like me, is that they can provide diagnostic imaging, diagnostic testing that gives us feedback as to is what I'm doing working or not. I have a lady who she had a tumor on her facial nerve. And so they're constantly monitoring her. So over time, if her and I were just setting up for the first time, if that's not decreasing in size, then that means that there's something wrong with the method and she and I need to shift in one way or another. So in other words, it could be done in multiple different ways and they can complement each other as well.
I mean, can you maybe share some stories of some of the clients that you work with? What type of results do they get?
Well, interesting enough, this just happened recently. Is I was actually out. I was down south in Southern California, and there was a lady that fell ill with food poisoning. Now, we didn't know it was food poisoning at first. She was just very pale with very low blood pressure and was basically fainting and collapsing. So we called the paramedics, but she was really, in a sense, degenerating quite quickly. It was not a good situation. So in that situation, while we were waiting for the paramedics, I went ahead and began to work on her. After finding what I needed to find, not to get into too many details, and correcting what I could, the paramedics arrived. They checked her blood pressure was fine. They checked her blood sugar was fine. So any other probable causes that it could have been seemed to be okay. So they were wheeling her out. Now, remember, at this point, we didn't know it was food poisoning yet. And so they were going to take her to the emergency room, put her under observation, see what else they could do. On the way out, she vomited. Then she got in the ambulance and left. Now, once she got to the ED, that's when they started to suspect food poisoning. And yes, sure enough, she had eaten something that had been in her refrigerator that really wasn't working, but for whatever reason was okay in her mind at the time. So that's what caused her some food poisoning. But she told us later when she said that she began to feel better after she had vomited. She wasn't able to vomit before. So before that all had happened, she was belching, but nothing was coming out. It was instead trying to work its way through her digestive system. That's how it first manifested. She said, I need to go to the restroom. So it wasn't until after the session was done that her body was strong enough, in a sense, to vomit out whatever was causing her the issues. And then from there, she began to ameliorate.
Oh, it's kind of interesting. So, I mean, do you also incorporate like other types of, like you say, you do like the energy medicine, but do you also like you kind of like touched upon like TCM? Do you incorporate any type of like nutrition or herbs into your work that you do, or is it just strictly like energy work?
So I myself do also have some training with nutrition, some training with herbalism, and also with a lot of physical fitness, actually. So for me, it definitely is a holistic all because I could have a patient come in and our client come in, and yes, I'm working with the energy, I'm working with the spirit, I'm working with the physical matter. But at the end of the day, it's you really have to work fundamentally on all three levels. And the client themselves can work best with the physical. And so that manifests through movement, that manifests through nutrition, that manifests through herbs. And it's all supportive for what it is that we're trying to do. Usually when a client comes and visits me, they always get some sort of homework. And the homework is typically movement based, but occasionally we'll shift and say, okay, this time we're going to look at your food intake. This time we're going to look at your hydration intake. This time we're going to look at your sleep. This time we're going to look at these herbs. These might help you if you need them. And that's how I operate typically. So you really get this full holistic view because TCM, although although our theories are the same, there's a couple missing elements that TCM has, or there's a couple missing elements that we have that TCM doesn't. For example, a lot of the spiritual components are absent in TCM. And even within TCM, to be frank, there are some who don't even believe in the energetic aspects. They simply believe that needling or the chemical constituents in the herbs are enough.
Have you ever studied any acupuncture yourself?
I have, yeah. Part of the things that we did in China was doing acupuncture out there as well as cupping. So it's like that falls in. Like I have training in cupping, like that's done as well. It's just when we talk about the more physical methods, where so I'll put it this way. When my instructor went to China back in the 90s, there was a Qigong medical clinic there. And the Qigong medical clinic was divided into essentially two wings. Those who are sensitive to energetics, and so they would go see the medical Qigong doctors or the Chinese energetic medicine doctors, and those who were not sensitive at all. The ones who were sensitive specifically received just the energetic treatments, whereas the ones who were not sensitive would receive needles or massage, moxibustion, anything that was physical because they really couldn't feel the energy, it wasn't palpable for them. And they needed the physical means to get through and be able to initiate the process of healing. Because although it works really well, it's quite a profound difference between the energetics and the physical. So you could go receive an acupuncture treatment, sit there for 20, 30 minutes, however long it takes for you to receive your treatment, and leave, and the benefits may last up to one day. The thing is, the energy medicine is more profound, partially because we're working on three levels, but that leads to a stronger treatment that can last for up to 3 days if you did no additional work. If you did any of the additional homework, for example, that could span out to a total of at least 7 days.
Wow, it's really interesting. So, do you have any like recommendations of like daily practices or routines that like people like in the audience can do that's considered safe or not really? They have to see like a practitioner like you.
No, 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 there's definitely some safe practices, but it goes without saying that if you were to enter into this realm and begin to learn, do not go for the advanced practices. There was a guy, this wasn't Qigong or Taoist. Taoist is the philosophy that our medicine system is backed by. This guy was actually a Buddhist and he was working through Buddhism. He was really interested in Buddhism. He was a college professor. Now, there's different levels for these events that he would attend, like first level, second level, seventh level, and so on. Somehow, he got into a level six, I think it was, when he was supposed to be at a level three for whatever reason. Okay, so he went, he did it, he had a great time. The problem was when he came back, he was teaching class and he would break down in tears for the rest of the class. He would be driving home and his focus would just disappear. He said that time would slow down for him while he was driving home. So what would take 10 minutes felt like it took 2 hours. And so he was completely in a different state. So it should be said that yes, you can, just don't go for the advanced practices. The easiest thing anybody can do right now is as you're sitting where you are, take a breath in, a nice slow breath in, and notice what is filling. Is your chest filling or is your belly expanding and filling? Because that's the difference. If your chest is filling, you're not using your diaphragm. The diaphragm is the breathing muscle. And just the simple act of breathing and expanding the belly will cause profound shifts for people. The reason being is this. If you ever look at a baby or any animal, you'll notice that their abdomen swells with every breath. That's a natural state of breathing. But for us people, at some point, usually around the ages of 4 or 5, we shift from the abdomen to a chest breathing. What happens is this, and we'll put it as an example. Just as you're sitting there, I want you to gasp for me real quick. And when you do, does it fill your chest or does it fill your belly? If you gasp, it should fill your chest because that initiates a response to a threat. So if you're constantly breathing in through your chest, it's as if you're telling yourself you're in a threat, you're in a dangerous environment. So you're constantly activating what's known as the sympathetic system. That's the fight or flight system. Until you can actually start breathing with the diaphragm, expanding the belly, then are you able to shift because that'll actually activate the parasympathetic system through what's known as the vagus nerve and bring you back down to a calm state. So really the easiest thing for most people is notice, are you breathing in through your chest or are you breathing in through your belly? If you're breathing in through your chest, do you suffer from stress? Do you suffer from anxiety? Because I could tell you, if you make a shift, that alone will give you such a profound change in your life that you will wonder, how did you live so long?
That's really interesting. I mean, what do you think are some like the biggest misunderstandings that people have about energy healing and Chinese medicine?
There's quite an exhaustive list. So I would say the first thing is we're taking the Chinese language, which is a symbolic language where a symbol could mean many different things, and then you're trying to take it and translate it into English as one case example. All you have to do is go find what's known as the Tao Te Ching, which is one of the core books written by Lao Tzu, and look at how many different translations there are and actually flip through them and see how the things are translated. So right there, we already have a mismatch. That's the first thing. The second thing is that a lot of the concepts that come from the East do not get properly disseminated into the not just lexicon, but the mindset of people. So when we talk about qi, most people say, well, what the heck is qi? Yeah. If you look at it from a different perspective, let's talk about like an alchemical perspective, a hermetic perspective. They call it like the prima materia. Or if you look at a Hindu perspective, they call it prana. Okay. It's kind of a catch-all name for the substance that is all around us. Some people may call it ether, for example. But qi is not just that, it's also a concept because within it, there's subdivisions. There's qi that's in food, that when you consume it, gets separated by the digestive system. There's, of course, the qi of the breath that we take in, but there's also defensive qi that exists along the body called the wei qi, and that's responsible for also buffeting threats that would otherwise be affecting us. So I think one of the major concepts is the misunderstanding of what qi really is. And another one that, although maybe it's gotten a little better, is also the meditative aspect. I don't think meditation has really disseminated properly through the mediums that were presented to us.
So now I believe you also like teach Qigong and energy medicine now, right? Is that what you were saying before?
I do teach some things, like there's some not open to the public yet, but there is some like hermetic alchemical stuff that gets taught. But also there is a course that I have that's up and coming that's specifically for letting go. Because one of the biggest things that you'll see is when you get caught in a loop, it's usually because it's difficult for us to let something or someone go. One of the saddest things I saw was, not to go into too many details, but it was essentially family members that would not let a family member go when it was their time. And when you think about it, you have a person who's essentially in a state of suffering the entire time because their family members don't want to let them go. And I understand from a caring perspective, but it causes undue suffering. Yeah. And this is partially what the Buddhists refer to when they talk about attachment and suffering, is the attachment to things do cause us suffering through unmet expectations. As an example, I might want to be an actor. And so I go expecting that I'm going to land this role. I practiced it well, and then I don't get it. And then that'll cause me the suffering. So in the West, we're very goal oriented, very, very goal oriented for the end result. But it's never really about the end result itself. It's about the path that you take, because the end result's going to be whatever it's going to be. That's hard to control in most instances. Really, it boils down to how is it that you get there? I kind of like to compare it to taking the scenic route as opposed to taking the direct route. You're still going to get there, but it's a lot more pleasant to take the scenic route.
So, I mean, what was fulfilling about teaching?
The biggest thing that's fulfilling for me for teaching is, like I said, I used to see people that would come in and they would have the same issues they were caused by their same tendencies, typically, although not always. And it seemed like there was no option for them to let that go or for them to be able to remove it. It was, I'm doing this, I'm feeling this, can you get rid of it? Okay, great. And then you get rid of it and then you come back. It's like why needlessly suffer? Yeah. Some people don't want to, and that's understandable. But there were people that genuinely didn't want to have the same issue anymore, but they felt like they had no option. And so they just feel like they were stuck in this situation. There was a lady who, this one was a bit of a heavy one, but she had a tumor that was growing on top of an artery that leads to the lungs. So essentially, blood flow was being blocked through one of the lungs. Now, for her, this was when I was working in the cardiac procedures. We were able to give her a few more years by doing a couple things that we did to prevent it from growing into the artery and occluding flow and causing her demise. But she did show up a few years later, and it had actually grown into the heart and was now occluding the flow in the heart itself. So we did what we could and we tacked it up in whatever way we could, but all we were doing was just delaying her time at that moment. Now, as a doctor of Chinese energetic medicine, it's like the approach would be different. The idea would be the same. We want all them ultimately to be better. But you can only be better if you remove the obstacles that are in the way. And sometimes the obstacle is you, ultimately. Like we are our own greatest critics, and that stops us a lot.
So what do you do if the problem is like the person or the client? I mean, do you have a
Well,
conversation with them, or like do you need to help shift their beliefs?
there's always a conversation, but it's always what I'm doing is optimizing the environment, the bodily environment, and whatever wants to blossom and come out will come out naturally. There's times and places where things will be removed. For example, there's what I like to call the easy stuff. Think about all the times your order was wrong. Think about all the times that you were cut off from driving. Just all these little inconveniences. It's like a beaver building a dam. All those little sticks stack up. Those are the easy ones because it doesn't really matter as much. They weren't major things in your life, they were just little inconveniences. So that's one of the things that I would swipe away. Now, once that's swiped away, now the river begins to flow. And as that river begins to flow, now you can actually hit to where the big issues are. And over time, that flow, just like water, will wear down at it and it itself will present itself. So really, I set the stage for it, and it's up to the person themselves whenever they're ready for that to come forth.
So I know you mentioned before, like you're constantly like training and exploring, things. What are you most excited to learn and integrate next?
Great question. I'm finishing up some herbalism training that is tied to the zodiac. There's an interesting thing where we have these. So, even in the Chinese medicine aspect, we look at what's your astrological thing, because there's a whole Chinese version of it, yes? But it's within these two, it is a blueprint in a sense. It's a blueprint not just of who you are, but what's expected to come too, like the certain patterns and lessons you may learn. And within that, you could better prepare yourself, for example. But sometimes the issue that comes about is something that's unexpected. There was a man in the 1600s, I believe, okay, who was an alchemist. His name was Paracelsus. And the term that I'm using is one that he coined where he called it ens astrale. And ens astrale was referring to like the pain related to the stars. And so it was clients would come in and they would have this pain that you couldn't explain away with anything. Like it's not, let's say, if I was to give terms, it's not a disease, it's not a condition, it's not an injury. They just had pain. And what he noticed is when he was looking at the zodiacal charts that, oh, the way these stars are lined up, that's what the pain's related to. So then he was able to formulate tinctures and recipes to then help alleviate and remove that problem so they wouldn't experience it again.
Oh, that sounds very interesting.
Yeah, it's really exciting. So
do you find that like because you mentioned before like this energy medicine's probably been around for hundreds, if not thousands of years, but it seems like it's some people are more open to it now. And do you see it like there's more interest now than there was here, like in the United States, than there was in the past, maybe like 10 or 20 years ago?
I would definitely say there's more interest now than there was before. It's always existed, just like most of the other, you could say, I mean, I don't want to say esoteric medicines, but that's really what it is in a sense, because they always ended up being in small communities, yeah? I think there is a rise. And like Chinese medicine, as far as we know, the written record is, somewhere around 5 to 6,000 years that it's been around. And who knows how much longer before that? We don't really have a written record. We don't know. You think about agriculture and civilization being around, I think the last projected date that I remember was 13,000 years or so, or 11,000 years. Then you would think that it's probably been around longer. We don't know. The issue is that, like I said, when the communists came in and they took over in China, they did away with everything at first. Then they tried to bring everything back, but scientifically validate it. And Qigong was one of those. And unfortunately, about 25 years ago, it was actually done away with because there was a group who kind of used it militantly. They were quite critical of the government, which that's fine if they wanted to voice their opinion and be against the communist government in China. But they were using the medicine that we had as kind of the reason to like go against them and arise above it. And so what happened is anybody that was associated with that had to either defect or go into hiding. And those hospitals where they had all of this evidence, case studies, and techniques like closed down because of it, because they were now afraid that they were going to get imprisoned by the government. So that kind of delayed a lot of things. I think we would have seen that rise sooner. But there is a general openness now, more so than before, to the different energetic medicines that exist, of which Chinese energetic medicine is just one.
So if somebody's listening to this podcast interview and they feel like disconnected or stuck in life, what can you say to them to encourage them to consider like holistic healing?
The only way to know is to try it. Find something that resonates. You'll know when you find it. You got to stick to something that you'll say, hey, this sounds great. Let me go try it. And then once you do, you need to find someone within that field that you resonate with as well, someone that you agree with, someone that would feel trustworthy to you. Because let's be honest, it's quite unfortunate, but even within this field, there are lots of fraudsters that still exist. And I think that also helps to delay like energy as a medicine coming forward more and entering the minds of more people. But the biggest thing is really find a modality and find a person who you can trust and then proceed that way. Because without the trust, you're not able to actually open up and let go of what's stopping you, like especially if you're stuck. I mean, could you imagine if you're feeling terrible about your life situation only to go to someone that's supposedly trustworthy and then get swindled? So it can be a difficult thing for some people, but if you look for it, it will come to you. It's one of those things that you don't necessarily find it so much as it finds you.
Okay, well, the time of our podcast is starting to wrap up. Is there any like last words you'd like to share with the audience?
The biggest thing that I want to share is that everything you need, you have within you. It just needs to come forth. It's just like the soil in the earth. If the seed is planted there, the seed will sprout. You cannot control what the seed is. You cannot control when it will sprout. And even when it does sprout, you cannot control when it bears fruit. But you can't optimize the conditions for everything to happen as it is intended to happen. It all exists there. It just needs a little trust.
And if somebody has any questions about this interview or is interested in working with you, how can they get in touch with you?
Absolutely. So through my website, there's a option to have a 15-minute consultation. And there you can ask your questions about a little more. What is it that I do? What does it look like? How does this function? And we have basically a little meet and greet. And if it feels right, then of course that can proceed to the next thing. Also on the website, I will be writing blog posts over time. I have a couple now, but over time there will be more. So if there's interest in a specific topic, then you can go read up a little bit on it.
Great. Well, Jose, thank you so much for coming on this podcast and sharing experiences. I really appreciate it. Thank you again and take care.
Absolutely. My pleasure. Thank you.